Okay, so we are going to discuss the EKG. So we're going to start with labeling each part of the EKG. So you've got the P wave, the Q wave, R wave, S wave, and T wave. Then in between some of these, you've got different parts. So we've got the PR segment here between the P wave and the Q wave. And then between the S wave and the T wave, you have what we're going to call the ST segment. Now, each part of this wave corresponds to what's happening in the heart during each part. So, for example, we are going to talk P wave first. So if we go up here, we have the heart with the SA node. Okay, so this is the SA node. This will be what starts the impulse of the heart. So every heartbeat that you have is started by the SA node. Okay, then down here you've got another node, okay, called the AV node. This is where the SA node is sending its impulses. The AV node also sends impulses throughout the middle of the heart and then around to the ventricles later in this conversation. So we are going to start with the P wave. So as you can see, we are sending a message from the SA node down to the AV node. What's important to note about this is that it's going around, straight towards, and then around the other side. So when you look at this, I'm hoping that you can see that these arrows are going to cover all the muscles that surround the atria. So as you look at this, what we're looking at specifically is what we're going to call depolarization of different areas within the heart. So depolarization means change from negative to positive. Now, what we're changing is going to be the voltage within a muscle. So we've got different muscles all throughout our body. Right now, we are specifically talking about heart muscles, okay, cardiac muscles. So as you look at this, we're trying to depolarize all of the muscles that surround the atria, these top chambers of the heart. Once those muscles are depolarized, okay, which means we're going from negative to positive. The way the body does that is by the use of sodium, okay, sodium. So we're going to send that sodium into the muscle, and it's going to start changing the voltage inside the muscle from negative to positive. Okay, so as we do this, we are doing this around the atria first through these red lines. So essentially, you have nerves around your atria that will send impulses through the muscles that surround the atria. When that happens, those muscles will contract. When the muscles around the atria contract, it pushes the blood down into the lower chambers of the heart. So what we are looking at is what we're going to call atrial depolarization. Atrial depolarization, which all that means, once again, is that the muscles around the atria are being changed from negative to positive through the use of sodium. That's essentially all that means. Now, when we get into the next step of the EKG, okay, so what we just went over, if you go back down here, is the P wave, which we're going to call atrial depolarization. The next step is going to be the ST segment. So you'll notice that those red lines are gone because we've sent the impulse from the SA node to the AV node. Now, there's a pause at the AV node. Okay? Pause at the AV node. Now, the way this is shown on the EKG is this ST segment. So we're just going step by step through the EKG. The ST segment represents that there is a pause at this AV node. Okay? Now, we have now paused at the AV node, and now that impulse must move down from the AV node through the middle of the heart. Because remember, we're trying to depolarize all the muscles within the heart. Okay, so through the P wave, we've depolarized the atria, we've paused at the AV node, and now we're moving down the middle of the heart. This middle part of the heart, okay, that runs right here, okay, is going to be called the interventricular septum. So what that means is that there is a section of the heart between the ventricles that's made up of muscle called the interventricular septum. Now, if you look at these lines, the blue lines are showing that there are nerves that are depolarizing these muscles. Okay, so before we get into that, I want to label these two things. So this is called the bundle of His, and then it splits into what we're going to call the left and right bundle branches. So these are nerves that run down through the interventricular septum that help to depolarize that middle section of the heart. So through this, we are going to depolarize all of this section here. Okay? And we're going to call that the Q wave, which can also be called septal because it's referring to the septum depolarization, because we're changing that voltage from negative to positive. Now, we will move from there into the next part. So you'll notice now, through the Q wave, through this septal depolarization, this is done. The muscles there are depolarized and they are ready to contract. This next part is the R wave. Okay, these green lines start to depolarize the muscles in this area. Now, when we look at that, what we hopefully will see is that we're depolarizing those muscles around the bottom section of the heart. We're going to call this the R wave. Okay, it'll be shown on the EKG as this big peak that comes up, and it represents a portion of ventricular depolarization. Now, I say a portion because all of the ventricles are not depolarized at this point. There's one additional step that will allow the muscles around the ventricles to contract. So now, that is the R wave. The S wave will be shown like this. So now we've got all of this depolarized through the Q wave. We're depolarizing all of this through the R wave. And then this S wave will start to depolarize all of this space here. So essentially now, through this S wave on the EKG, we've shown that the heart is, the ventricles are completely depolarized so that they can contract. Now, what exactly is depolarizing here? Okay, so like I said, this is the S wave. We're going to call this depolarization of the Purkinje fibers. Now, what are the Purkinje fibers? So, on the heart, you've got nerves that run all through the muscles of the ventricles. Okay, so for example, you have nerves that run all through this area. You've got nerves that run all through this area, all through this area, all the way up. You also have nerves that run through the muscle that's in the middle here. The muscles that surround the ventricles also must be depolarized. Okay, this section that I'm outlining, that I'm circling, that's where you will find the Purkinje fibers. It's just nerves that run all throughout the walls of the ventricles. Okay, now that is shown as the S wave. Okay, so if we go down here, that is shown as the S wave. So when you see an S wave, you can assume that the ventricles have been completely depolarized because the S wave is showing that the Purkinje fibers have been depolarized. Now, this last section, okay, this ST segment, is going to be a pause between ventricular depolarization that just happened with the S wave and ventricular repolarization, which is about to happen. There's a brief pause between ventricular depolarization and ventricular repolarization. That brief pause is shown on the EKG as this ST segment. So everything in all the muscles around the ventricles have depolarized, meaning they're now more towards positive, and they've contracted. Once that happens, you will have the final step, which is called the T wave. So this is showing the T wave, and this represents ventricular repolarization. Now, what that's showing is that we're going from positive back to negative. What that means is once those muscles contract, we stop bringing in the sodium. So once we stop bringing in the sodium, the muscles will then start to change back toward that negative where they started. So they're basically going back to normal. So every time there's a contraction, the muscle must repolarize before it can depolarize and contract. The way this looks on the EKG is this T wave. So that is ventricular repolarization, preparing then for that next time that the ventricles must depolarize. Last and final point is after the P wave, going back to the beginning, after this P wave, which is atrial depolarization, these muscles around the atria must also repolarize before the next time they need to depolarize and contract. The way that works is between this beginning of this Q wave and the end of the S wave, you will also have what's called atrial repolarization. Because depolarization within the ventricles is so strong, you will not see this represented on the EKG. So you will not see atrial repolarization on the EKG. Just know that it's happening, okay, within what we're going to call the QRS complex, which is what I've shown in this area that is shaded. Okay, I hope that helps. If you have questions about it, please write them down, and then when you come to class, we can discuss the next steps or clarify anything that needs to be clarified.